Hello everyone, I'm Dr. Purnima kushwaha, physiotherapist. Welcome you all to my channel. In this video, we're gonna be talk about asthma. What is asthma? The term asthma is derived from a Greek word meaning panting or labored breathing, that is, difficulty in breathing. Definition of asthma is that it is a chronic inflammatory condition of the lung airway that causes episodic airflow obstruction and airway hyperresponsiveness to certain provocative factors. Here is the triad of asthma that usually occur, that is airway obstruction, inflammation, smooth muscle hyperplasia with hyperactivity. In this image, you can see the normal airway passage, whereas during asthmatic symptom, you can see the triad of asthma which I told you above. That is narrowing of the airway passage due to smooth muscle contraction or tightened muscle that constrict the airway. The wall of airway get inflamed, thickened, and there is accumulation of mucus due to release of mediator in response to allergens, which further narrowing the airway passage. Incidence of asthma. Worldwide, approximately 300 million people have asthma, and this is expected to rise to 400 million by 2025. In childhood, asthma is more common in boys, but following puberty, females are more frequently affected. Asthma is more common in developed countries and urbanized areas. Etiology and risk factors. The exact mechanism of onset is still unknown, but we can understand by these factors: genetic factors like genes predisposing to airway hyperresponsiveness, environment factors such as house dust mite, exposure to tobacco smoke predisposed to animal pollen molds and dust, dietary changes, junk food and fast food contain MSG. Lack of exercise, occupational exposure like irritants in the workplace such as chemicals, dust, molds and pollen. These can be found in industries such as baking, spray painting of cars, woodworking, chemical production and farming. Atopic diseases like eczema and rhinitis, maternal status like both physical and mental condition like anemia and depression in the mother are associated with asthmatic stress in the child. Early antibiotic use. It is seen that babies who are given antibiotic may be 50% more likely to develop asthma by the age of 6. Now these are the asthma triggers which causes the symptom of asthma. Now let's see the type of asthma. There are primarily two types of asthma present, known as extrinsic asthma and intrinsic asthma, whereas other type of asthma are also there, like mixed asthma, occupational asthma, drug-induced asthma, exercise-induced asthma, cough variant asthma, and nocturnal asthma. So let's talk about each type of asthma one by one. Extrinsic asthma. This is early onset or childhood asthma. These are hypersensitive asthmatic children who develop commonly IgE antibodies to allergens, hence called atopic asthma. It is episodic and sudden onset. There is more wheeze and less cough. It is mostly seasonal. Attacks may be precipitate at any time of the day or night or exercise. There is positive family history for an allergic disorder such as eczema, rhinitis, urticaria. Skin tests for hypersensitivity are positive. Intrinsic asthma. This is late onset or adult asthma. Atopy or extrinsic allergen does not play any role, hence called non-atopic asthma. It is non-episodic and chronic or continuous asthma. There is more productive cough and less wheeze. It is mostly non-seasonal. Attacks mostly occur at night and it is not exercise induced. There is no family history. Skin tests are negative. Other types of asthma. First is mixed asthma. It is the combination of both atopic and non-atopic asthma. This is the most common form of asthma. Next is occupational asthma. It is induced by triggers that exist in person's workplace, including textile, farming, woodworking, etc. Next is drug-induced asthma, that is aspirin-induced asthma and NSAIDs-induced asthma. Exercise-induced asthma. It affects the person during or after physical activity. Cough variant asthma. This does not have classic symptoms of asthma such as wheezing and shortness of breath. Instead, it is characterized by one symptom, a persistent dry cough. Nocturnal asthma. Symptoms that get worse at night. Clinical manifestation such as wheezing, dyspnea, cough, chest tightness, expiration may become prolonged, fatigue, and sputum is thick or stringy. Diagnosis can be done by following ways. First, history taking. A complete family, environmental, and occupational history is essential. Then, physical examination. We look for the symptom of asthma such as wheeze, dyspnea, accessory muscle movement. We check for the skin allergies such as eczema and allergic rhinitis. Then we go for the investigation. Sputum and blood examination may show eosinophils. Serum IgE levels are raised in atopic asthma. Chest X-ray. There is no diagnostic feature in asthma, but may be helpful in excluding pneumothorax as a complication of asthma. Pulmonary function test may show variable airflow limitation. Arterial blood gas analysis. PaO2 and PaCO2 are performed invariably in severe acute asthma. There is evidence of hypoxemia and respiratory alkalosis in acute asthma attack. Skin hypersensitivity test. It is done to identify the allergic cause. It is a patch test is done with aqueous solution of the substance to be tested. A positive reaction indicate wheal and flare development which begin within few minutes. Thank you for watching this video. Hope you like it. Do share among your friends. Subscribe to my channel and press the bell icon for future notification.